The Power of Knowing Why Drug Classification Matters, written by Dr. Sanjay Gupta. Imagine walking into a library with millions of books and no catalogue. Overwhelming, right? That's what navigating the world of pharmacology feels like without understanding drug classification. For medical students and professionals, it's not just about memorizing names, it's about understanding how drugs work, their potential benefits and risks. Drug classification provides the framework to make sense of this vast and complex world, ensuring safe and effective patient care. Think of it like organizing a toolbox. You wouldn't just throw all your tools in a pile, would you? You'd group them by function hammers with hammers, screwdrivers with screwdrivers. Drug classification is similar. It groups medications based on shared characteristics, making it easier to understand their actions and potential uses. This knowledge is crucial for prescribing the right medication for the right patient. Understanding the different classifications empowers healthcare providers to make informed decisions, predict potential drug interactions, and ultimately provide the best possible care for their patients. What's the goal? Understanding drugs by therapeutic use. One of the most intuitive ways we classify drugs is by their therapeutic use, essentially what they're designed to do. This approach focuses on the drug's intended effect on the body and the symptoms it aims to alleviate. For example, if you have a pounding headache, you might reach for an analgesic like ibuprofen or acetaminophen to relieve the pain. These drugs fall under the category of analgesics, specifically non-steroidal anti-inflammatory drugs known for their pain-relieving and fever-reducing properties. Antibiotics, on the other hand, are used to fight bacterial infections. Think of amoxicillin, often prescribed for ear infections, or azithromycin, used for respiratory infections. These drugs work by either killing bacteria or inhibiting their growth, effectively combating the infection. Similarly, we have antivirals for viral infections, antihypertensives to lower blood pressure, diuretics to increase urine production, anticoagulants to prevent blood clots, and antiplatelets to prevent platelet aggregation. How do they work? Decoding mechanisms of action. Beyond their therapeutic use, drugs are also classified based on their mechanism of action, how they interact with the body at a molecular level to produce their effects. This classification delves into the intricate ways drugs target specific cells, receptors, enzymes, or ion channels to achieve their therapeutic goals. One example is enzyme inhibitors. These drugs work by blocking the activity of specific enzymes involved in various bodily processes. For instance, ACE inhibitors, commonly prescribed for hypertension, work by inhibiting the angiotensin-converting enzyme, which plays a role in blood pressure regulation. Then we have receptor agonists and antagonists. Agonists like morphine mimic the action of natural substances by binding to and activating specific receptors in the body. Antagonists, like beta blockers used for heart conditions, block the access or binding of natural substances to their receptors, thereby inhibiting their effects. Ion channel blockers, another important category, work by blocking the flow of ions through cell membranes. Local anesthetics like lidocaine, used to numb a specific area, fall under this category, preventing nerve cells from sending pain signals to the brain. Chemical blueprints, classifying drugs by structure. Another way to classify drugs is based on their chemical structure. This approach groups drugs that share similar chemical frameworks, often indicating similarities in their pharmacological properties, mechanisms of action, and potential side effects. For instance, penicillins, a group of antibiotics, all share a common beta-lactam ring in their chemical structure. This structural similarity gives them their characteristic antibacterial activity by interfering with bacterial cell wall synthesis. Benzodiazepines, a class of drugs with sedative, hypnotic, anxiolytic, and anticonvulsant properties, also share a common chemical structure. Drugs like diazepam and alprazolam fall under this category, exhibiting their effects by enhancing the action of a neurotransmitter called GABA in the brain. Similarly, steroids like cortisol and testosterone share a characteristic four-ring structure, despite having diverse functions in the body. This classification helps understand their potential for hormonal effects and